Well, it's midday in GMT where I am, where I find myself. And so I'll be saying good afternoon to those of you who are within my time zone and those of you beyond my time zone. There are still others who are very early in the morning, and I'd say good morning to you. And for others, it might be already late in the evening. To them, I would say good evening. And welcome to this session of the African Tobacco Control Talks. My name is Caleb Ayong. I'm the program coordinator of the African Tobacco Control Alliance. And we are pleased to have the opportunity to host this webinar with Economics for Health, which is a very respected entity globally in the tobacco control and taxation space, I would say. And today we have a lineup of interesting, very powerful speakers. I would say we've brought in some of the best within the continent to brief us on something very important, something that we are talking about a lot these days, because many of us in the public health space are beginning to see resources dwindle. And how do we get self-sufficient? That is part of what we'll be discussing today. I'm going to serve as your moderator. It is my honor to serve you today. And let me let you know already, we indicated that we have interpretation services available for this webinar. You can listen to the webinar in English, in French, or in Portuguese. So please feel free to choose your language of preference from the interpretation icon just below your screen. And I'll say this in French so that our French-speaking listeners can also pick it up and probably go for interpretation. Bonjour, mesdames et messieurs. Je vous informe que nous avons des services d'interprétation pour ce webinaire. Donc, vous pouvez suivre le webinaire entier en anglais. Il suffit euh, de cliquer sur l'icône d'interprétation et choisir le français et vous pouvez suivre intégralement en français. Merci beaucoup. My job is to moderate, so I don't have much to say, but we are here to launch the tobacco tax score. And what is that? What is the tobacco tax score? You get to know much about it in the course of this webinar. But like I said, we'll also be discussing something very important around taxation, adequately taxing tobacco products, and then allocating resources which we can use to fund our public health initiatives. But to get things started, permit me welcome the Executive Secretary of the African Tobacco Control Alliance, which is co-organizing this webinar. She's going to give us some opening remarks. That's Dr. Gloria Gonese. Dr. Gonese, you have the floor.
To all our distinguished speakers, government officials, policymakers, civil society organizations, public health advocates, researchers, regional bodies, international organizations, and colleagues joining us from across Africa and around the world. It is my singular honor to welcome you all to this very important platform, a landmark webinar to launch and disseminate the Africa Cigarette Tax Scorecard in partnership with Economics for Health. Tobacco remains one of the leading preventable causes of non-communicable diseases and premature death across Africa. Beyond its devastating health toll, tobacco imposes severe social, environmental, and economic strains, leaving developing nations to absorb mounting healthcare expenses and staggering productivity losses. Addressing this crisis requires strategic interventions that not only diminish consumption, but also alleviate the financial pressure on the national health systems. Tobacco taxation through well-designed excise tax structures stands out as one of the most powerful policy levers available for sustainable domestic resources. It discourages consumption and reduces long-term healthcare burdens while generating predictable, dedicated new revenues that can be funneled directly into public health initiatives. To track and evaluate progress in national tax policy implementation, Economics for Health developed the Cigarette Tax Scorecard and periodically updates it using credible data sources to assess performance across many countries on key metrics such as the price, affordability trends, tax share, and overall tax structure. As a result, over the years, the scorecard has established an evidence-based benchmark that provides policymakers and advocates with a clear, actionable evaluation of their national tobacco tax policies. This webinar bridges global policy evidence with regional action, combining world-class economic research with Pan-African advocacy leadership. The webinar offers a timely platform to unpack the latest scorecard findings, spotlight regional success stories, and demonstrate how African nations can leverage taxes to strengthen fiscal health and advance long-term health sovereignty. Across the African continent, the conversation around public health financing is undergoing a fundamental shift. And the question that comes to mind is, as external funding landscape evolve, how can African governments secure sustainable, independent revenue for national health system? And the answer lies in strategic fiscal policy. So we are highly privileged today to have a variety of great speakers that will expertly present the latest cigarette tax scorecard scores, policy insights, and recommendations specific to Africa. We'll also get to hear about Africa regional success stories, focusing on domestic resource mobilization and recent policy reforms. I'm confident that many of us that have joined this webinar will learn from the practical approaches that will be shared today in order to strengthen tobacco tax structures in line with the World Health Organization Framework Convention on Tobacco Control, Article 6 guidelines. As I hand over the platform back to the moderator, I invite you all to actively engage throughout the webinar and take some lessons back to our various spaces to strengthen domestic resource funding in Africa. I thank you.
Thank you very much, Dr. Gloria Gonese, Executive Secretary of the African Tobacco Control Alliance. And your address is, in fact, leading the way to the launch of the tax score. And one key thing I picked from your communication is that we take out practical lessons from here that we can use to scale up in our respective countries. And I'm hoping that as we begin to go through and pick out the case studies we'll be learning today, they serve as inspiration for us to trigger a real and a convincing discourse around effective domestic resource mobilizations in our country. We are here to launch the Cigarette Tax Score, and that is what we're going to do right now before we start engaging in some practical case studies. And for that, I would like to now welcome Jeff who is the Director of Economics for Health and who leads the production of the Cigarette Tax Score. We're in the fourth edition this year. And so what do we have for Africa? Jeff, you can take it away.
Thank you so much, Caleb. It is a genuine pleasure to be here. I feel like I am among giants here because these are not only regional amazing case studies that we're going to hear from today, but these are global case studies that I think any region can look to Africa as an example of some really encouraging things that are happening on the ground in terms of tobacco taxation. So let me just get the slideshow set here. As Caleb said, this is the fourth edition of the Cigarette Tax Scorecard, so it is a real pleasure to be able to share the results with you for the African region. We have actually a policy note that is now up on our website. So please go visit us at the website, which gives a really nice précis of everything I'm going to say today. It's available in French and Portuguese as well as English. And of course, the whole scorecard is available as well if you want to read the entire document, which we would love it if you did. So that is also available in all three languages, as well as Spanish and Arabic and Indonesian and Vietnamese, I believe. So I hopefully one of those languages will suit you. I want to thank all of the folks on this slide and more, but it is really a pleasure to work with the Africa Tobacco Control Alliance on this project. They're doing amazing work on the continent. Today's panelists, as I said, are all really impressive people and doing impressive things with their colleagues in their countries on tobacco taxation, and in the case of Linstrom, regionally as well. So we really seeing so many great things on the continent. I have amazing co-authors. It takes a village to put all of this together. It's a lot of work, and I'm very grateful to all of them. I'm grateful to the WHO tax team in Geneva, the Fiscal Policies for Health team. They have been nothing but incredibly supportive and help us out with their amazing data every time we bring a new addition to the floor here. And most of all, I thank all of you for taking the time to be here today. I know you're all busy. This is a really important topic, and I am glad that we're here to talk about it. I don't think I need to say much about why we're here. Dr. Gonese really covered it nicely. Too many people are dying. Too many young people are still starting to smoke and use other tobacco products. This is a big problem. But what we do know, as both Dr. Gonese and Caleb said, is that we have a huge opportunity here, first of all, to drive down consumption through better tobacco taxes, but also more specifically to raise some more money in the fiscal space, because we can actually use those tax revenues to go back to good policy areas like health and education. Again, Dr. Gonese nicely covered the four components, so I won't go over that, but I will mention that we will have the slides available to you. We will put that on our website as well, so you can also go and download the slide deck. We use primarily the WHO's biannual reports on tobacco control. If you haven't seen these reports, they're fantastic. They're very comprehensive. They include not just taxation, but many other things. And we use these data. There's also some background data they very kindly let us use. And again, we're very grateful for this help that we get from them. The scorecard's been subjected to extensive peer review over the years. Of course, we don't always agree on everything. There are different and difficult decisions that need to be made to make something like this. But we take all responsibility for any errors, of course. So let's get right into it. The overall score. If we look at this is a nice heat map. We see so dark green is good and light green is not good. And we see some emerging examples of dark green, but we see an awful lot of light green on this map. And that means we still have work to do on the continent for sure. And I like to cast this in a positive light. This means that we have incredible opportunity in really, frankly, every country on the continent, some more than others, to raise tobacco taxes and to drive down consumption, and then to be able to use those new tax revenues. We can compare the African region there in green to the other WHO regions, and we can see that it is actually the lowest of the 6 regions. I can also tell you that Sub-Saharan Africa, as a major subset of the African region, is just a little bit lower at 1.43. So again, as I said, lots of room to grow and lots of opportunities to employ tobacco taxes much more effectively. This is the scores by country, the overall scores by country, and you can see an incredible range here. We have some very high performers or higher performers, but you can see even the higher performers have some room to grow. And then we can see a lot of countries over on the right-hand side of this figure in the 0 to 1 range, really about half the countries are below 1.5 out of 5. So we can see a tremendous amount of room to grow. And I'll discuss in a little more detail what these actually mean in terms of the component scores. Just to assure you, there are countries doing really, really well. We have countries up in the 4.2, 4.3 range. You can see the United Kingdom and Finland were the highest performers in the last scorecard. This changes, honestly, from year to year, and it doesn't always include high-income countries. We have some middle and lower-income countries that are doing extraordinarily well. So there is nothing in terms of the income level of the country that should stop it from doing tobacco taxation. If anything, as Caleb suggested, countries that are having some struggles in the fiscal space should be more incentivized to improve their tobacco taxation. So let's talk about price. Why does price matter? There's a whole lot here on this slide, but here's the key takeaway. This is what people react to. They react to price. So that more than anything, more than tax even, they're going to react to a change in price. As prices go up, people are going to consume less. We know that youth are especially sensitive to price, and we know that people in lower socioeconomic groups tend to be more sensitive to price as well. We use tax as the tool to get to those higher prices. So this is a really important variable that we look at. This is the scoring rubric. I'm not going to get deeply into it, but I can tell you that the high performance benchmark is 10 international dollars. It's actually 2018 international dollars, just because we want to compare across scorecards, across the 4 editions. And next year we'll have the 5th edition. So what we've learned is that $10 benchmark is one of a great, we see real positive change in terms of changes in consumption behavior. Here is another heat map. Again, dark green is good, light green not so good. And we can see quite a variation in terms of price. We have some very good performers there. We can see Seychelles actually scores a 5 out of 5. They have the highest prices in the region. But we know that most countries are somewhere around 2 to 4 international dollars for a pack of 20 cigarettes. Unfortunately, we see that 11 out of 49 countries received a score of 0, which means their prices were below $2. This is a very inexpensive pack of cigarettes, which makes it very accessible, especially for young people and also for folks in lower socioeconomic groups. Here is a comparison of African region to the other WHO regions and globally, and we can see that the prices on average are lowest in the African region. So again, I look at this as an opportunity. I can tell you that the tobacco industry is also looking at this as an opportunity, and that those prices are very low for the exact opposite reasons that we want. They're low because they're trying to gain new customers, and we want to drive those prices up through higher excise taxes. Changes in affordability. Again, I'm going to have lots on these slides and you can download them to read them more carefully, but the key point here is it is not just price, but it is also income. This is especially important in the African region because we have a lot of countries with high growth. So we can get changes in prices, but if people's incomes are going up, then their purchasing power is also improving. It's a double-edged sword here. We want that income growth, right? Of course we want that income growth. We want people to have more purchasing power, but we want them to purchase things like health and education and better housing, other good decisions that will engender prosperity in their households and in their communities. We don't want people buying more cigarettes or more other tobacco products. So we really look at this change in affordability, which combines both price and income. Again, I won't get into the rubric too much here. We've looked at where the benchmarks are in terms of the high-performing countries, and we have identified that 7.5% average change over the previous 6 years is our high water benchmark. Here we see not a great picture. That is an awful lot of light green. I could also show you the world, and I will tell you that it looks a lot the same. We had a lot of problems, I would say, with getting taxes to be high enough to change affordability. It was a 0.37 out of 5 on average, and so this is very low. However, you can see that there are countries that scored 3, 4, 5 out of 5. So we know that this is very much possible. And we know from previous editions of the scorecard that we've had far better years when a lot more countries were affecting affordability. We think maybe some governments are a little bit asleep at the wheel. You've got to keep up on your tobacco taxes. And we'll talk about this in structure. We're seeing a lot of countries not adjusting frequently enough, and as a result, and especially in the African region, because of economic growth, we're seeing that, in fact, in many countries, tobacco products are becoming more affordable, which is the last thing we want to see because we know that consumption goes up when these products become more affordable. Here it is again. You can see it's a tighter distribution here among the different WHO regions, but you can see again that Africa is having a little bit more of a struggle. But if you look across the dark red, you can see that Africa is not the worst performer in 2024. So it unfortunately has gone down, since 2020. But we really need to have governments really thinking about this affordability issue because it is a very, very important one. Let's go to tax share. This has sort of been the traditional measure that we've used to evaluate whether or not tobacco taxes are good in a country. It is the tax share of price. We look at both the excise taxes share and we also look at the total tax share. It's not a perfect measure because what happens is if prices are very low, which they are in many African countries, it's not a great measure because you can have a high tax share and low prices, and it will give you the illusion that you're doing well, but you're not. So that is why, in fact, it was our mild dissatisfaction with the tax share measure originally that led us to develop the scorecard because we realized we needed to have other components in order to give good counsel to our colleagues in governments around the world. As I said, we use two different benchmarks here. We use the all tax benchmark and then we use the excise tax benchmark, and we combine them together to create this measure. We like the excise tax measure probably a little bit better. The reason is that you can use excise taxes to change the relative prices. So as opposed to a sales tax or a VAT, which tends to affect most or all goods and services, an excise tax is very aimed at unhealthy products or other products that cause negative externalities. So things like tobacco, alcohol, fuel. So we need to be looking at these excise taxes very closely. I won't belabor this here, but I'll go straight to the heat map. And again, dark green is good, light green is not so good, and we see too much light green. So we know that tax shares are low. The average was 0.94 points out of 5. Again, we see some countries with some very high performance, and then we see a handful of countries with very low performance. What we do know is that when these tax shares are low, it means the government's not collecting very much tax revenue. And this is just an absolutely wasted opportunity. And I can tell you that the tobacco industry is happy to reap those profits instead. So it might as well be governments and societies that take the tax revenues and reallocate them towards the people. Again, here it is in comparison to the other African regions. We can see that tax share is lower in the African region compared to the other WHO regions. So again, a lot of room for growth, and I'm very excited about these possibilities. The final component is tax structure. I won't get too deeply into this, but what we do know is specific taxes or a reliance on more specific taxes. So these are taxes that are assessed per unit of product, like a stick of tobacco or a package, as opposed to an ad valorem tax, which is assessed on a percentage of the value. We really emphasize a greater reliance on the specific tax, and we give it a higher point score in our evaluation. We know that tax structures make a big difference in terms of being able to drive up prices, particularly of the cheapest brands, and then also to compress or to shrink the price dispersion. We don't want wide dispersion. We don't want really cheap products and really expensive products. What we want is, frankly, everything to be expensive, but we want at least not a lot of variation so that there aren't opportunities for consumers to find a cheaper product and substitute to it. I won't get into the rubric very deeply here, but it more or less reflects what I just said. I will note that we have seen in Africa in the last 10 years the reintroduction of some complex tax structures that try to privilege domestically made goods. Let me tell you that domestically made cigarettes are just as deadly as imported cigarettes. You should not privilege them in your tax system, but I'm happy to talk. See a lot more dark green, which is lovely. And you can see that the average score is 2.96 out of 5, which is much better. So we are making better progress on tax structures. And we can see that we actually have a good-sized handful of countries who score 5 points out of 5. A couple in the very low range, 0s and 1s, and some that I said have fallen back in recent years. But this is a much more encouraging sign here, and you can see when we compare it to the other WHO regions, Africa's doing actually pretty well. They're up in the top 3 and vying for top spot with the Americas region and the European region. So hats off to the African region governments for really starting to improve tax structures. We obviously still have work to do here, but we do know that tax structures are the foundation for good taxation. So I'm very excited to see the results here. So what to conclude? Prices are low. We need to raise these taxes so that we can get these prices up. This is very unfortunate because, as I said, this is what consumers react to. We need to improve this. As I said as well, that change in affordability is a real problem here. Tobacco products are too affordable in practically every single country, and in some countries are even actually getting more affordable, which is the wrong direction. Tax shares are still very low. Lost opportunity here. We want governments to be taking these as tax revenues, not tobacco companies taking these as profits. We're making huge strides on tax structure, but we still have some problems. We have one country with no excise tax at all. We have some countries with very problematic tiered structures. We have some systems that are ad valorem only. And then we also have specific tax structures that aren't adjusted upwards. And if you don't adjust your tax structures upwards, you're going to see that problem with affordability as the actual strength of that tax erodes over time because of inflation. So what do we need to do? Raise taxes. Really quite simple. And this is where we should be concentrating most of our efforts. We need to simplify some of the complex tax structures, but I'm going to go back to let's raise these tax rates as much as we can. It's going to lead to a healthier Africa, a more prosperous Africa, and I really think we're well on our way there. So thank you very much for your attention, and I'm going to hand it back over to Caleb.
Thank you. Thank you very much, Jess. And well, very inspiring statistics we're getting here. And I think two things I take away from your presentation. One, we have the opportunity to raise our taxes as much as possible, and there is still that space. We still have the opportunity to raise these taxes. We might think that we are doing a lot in terms of getting these taxes up, but we still have a lot to do. And the second thing I get is that we have the opportunity to use the revenue from these taxes to plow it back into the economy, maybe into health, into education, into other things that can make us grow our economy. And that's exactly what we want to talk about now in our next presentation. We want you to see an example of actually allocating resources. Wherever these resources are coming from, it is possible to actually allocate resources for public health in the country. And that's what we want to see in the next presentation. Before we get there, I would like to, the presentations are beginning to come in, so you definitely have questions to ask. So I see some questions coming up in the Q&A already, and we can also use the chat. By the way, it'll be interesting to let us know where you are, who you are, and where you're joining this call from. So if you can use the chat for that, please let us know. We'd love to. We would appreciate knowing you and where you're coming from. So feel free to put that in the chat. And if you have questions, please feel free to use the Q&A function to ask those questions. Let's now move on to looking at a case study of Ethiopia. Ethiopia has done very well in allocating resources for tobacco control, both at national and at local level. So this is something that is doable. When we say we can raise taxes and use some of these taxes, use some of the resources to actually plow it back into some of our tobacco control programs, it is possible. Ethiopia has done it, and we're going to hear their case study right now from our very good friend Tizita. She's coming to us from the Mathiwos Wondu Foundation. Tizita, welcome. Please, you have the floor.
Thank you, and thank you so much, Caleb, for this introduction. Good morning, good afternoon, good evening, everyone. I would also like to thank the ATCA and Economic for Health team at JHU for organizing this very timely and important webinar and inviting Ethiopia to share our recent success in terms of allocation of a dedicated and sustainable funding for tobacco control. So for the sake of better connectivity, I would like to stop my camera. I would like to turn my camera off and proceed with the presentation. So in the next couple of 10 minutes, we will look at the path that Ethiopia followed towards allocation of a dedicated public health funding to sustain enforcement of tobacco control. And before highlighting the advocacy approach that we followed, I would like to give you a few background information about the tobacco control funding status before the budget advocacy work was started. As shown even in the previous presentation, the government of Ethiopia had shown strong ownership and high level of commitment towards effective tobacco control, which ranged from adoption of a very comprehensive and FCTC compliant tobacco control proclamation, and also effective enforcement and significant achievements on 4 of the 6 Empower measures. And even before we start this advocacy agenda, tobacco control was one of the flagship projects at EFDA, and there was a budget allocation both from the government side and also allocation of additional budget from internal resource mobilization, particularly from partners and donors. And as shown in the figure here, as a project, FDA has planned to mobilize a total of 119.6 million Ethiopian birr for national implementation of tobacco control project over the previous 3 years. And the plan was 30% of this total budget was expected to be allocated from government, and the remaining 70% was expected to be raised from development partner. But when we look at the actual funding, the amount of budget received from the government over the past 3 years was just 6%, and the 30% plan could not be achieved. And again, in terms of internal resource mobilization, although the government planned to raise 70% of the initially planned budget, only 40% of it was found to be achieved. And this shows that how tobacco control funding was primarily relying on budget acquired from development partners and other internal sources, and the one from the government was very small. Again, as shown in the table below, this table shows the previous 1 year budget expenditure for tobacco control in the previous 1 year, and as shown here, even this very limited amount of budget was not entirely used for implementation of tobacco. Rather, it was shared with other projects like narcotic and psychotropic substances prevention and control. And we can see that how we were struggling with inadequate budget allocation. And at city administration level, again, there was a similar government leadership and commitment at Addis Ababa FDA, but most of the tobacco control activities there were campaign-based. This was due to significant resource limitation, and unlike to the federal EFDA, tobacco control was not totally included in the budget proposals, and also it was missed from the 3 years midterm expenditure framework of Addis Ababa FDA. And from both scenarios, we can see that tobacco control had no dedicated budget code, and also the primary source of funding was relying on donor support. And as you all know, currently global funding is significantly declining, so ensuring tobacco control enforcement sustainability through domestic funding was a must approach that we followed. Therefore, when we start the advocacy approach, there were different courtesy visits conducted to top leadership, directors, and also experts working on tobacco control and budget planning and allocation, both at federal and city administration level. And once we build the consensus and reach on strong support from the government officials, the next step was conducting political mapping and landscape analysis to better understand the budget allocation process in the country. Then we step up into evidence generation, because this is an advocacy work and it should be backed up with adequate evidence to let the higher officials at the Ministry of Finance and Finance Bureau of Addis Ababa make informed decisions. Therefore, we conducted intensive desk review and gathered all available evidences which show the health, economic, social, and environmental burdens that tobacco control is bringing about in the country. We highlighted major achievements and enforcement impacts by bringing comparative data before adoption of the proclamation and after enforcement of the proclamation. This is one of the key information that the finance officials would love to hear about. We also highlighted in the proposal the different recognitions that the government received, and government should continue its reputation by allocating domestic funding for tobacco control and increased or intensified the enforcement status. We have also highlighted source of funding and how relying on donor support is becoming a real challenge to ensure the sustainability. We highlighted current enforcement gaps of tobacco control, and these gaps, they were not primarily due to weakness in the legislation, because we know that the proclamation is quite stringent, but mainly the enforcement gap was due to resource limitations, and there were strong justifications put in terms of increasing productivity, high return on investment, and enhanced government revenue. So for this budget request proposal to be easily understandable and quickly referable by decision makers at the Ministry of Finance, and to let them make informed decision, we generated a policy brief as shown here in the picture and widely circulated it for the decision makers. After that, there were quite a range of consultative workshops conducted both at federal and city administration level by engaging key decision makers in the budget process, so that we understand whether this tobacco control program-based budgeting will be feasible or not. And after the consultations, we built a common consensus and ground. And particularly at federal level, one of the most important activity which we considered it to be a game-changing event was the high-level consultative meetings that we conducted with the core budget team of the Ministry of Finance. Previously, EFTA just prepares the budget proposal and submits to the Ministry of Finance to pass the decision. So the Ministry of Finance officials, they pass their decision arbitrarily without having adequate understanding about the structure, scope of work of EFTA. So in this scenario, it created a face-to-face opportunity so that the finance officials well understood how EFTA is performing the tobacco control program, associated budget shortfall challenge, and so on. Additionally, the collaboration between the two organizations was better enhanced through office level visits done by Ministry of Finance officials. So they get first-hand information and better understanding on how the scope of work at EFTA is wider, and it requires additional amount of budget that used to be allocated in the previous time. And they also understand how tobacco control program is struggling with budget shortage, and they committed to support in whatever way possible through approving the amount of budget submitted by EFTA to support this initiative. At Addis Ababa city administration level, the scenario was quite different, because previously there was no government budget allocation for tobacco control. So the finance officials, they wanted to make sure that whether the tobacco control team at Addis Ababa FTA will be able to properly utilize the amount of budget to be allocated for tobacco control or not. So they just opened the code for tobacco control and internally allocated about 93,464 USD for a period of 4 months. These 4 months are the remaining timeline in the previous Ethiopian fiscal year, which ran from March to June. So by this time, we were quite worried because one, the duration was quite short, and the amount of budget was higher than we expected. And in June, there was a national election to happen. So most of the government's attention was diverted towards this election. So we were not quite sure whether we will be able to effectively utilize this budget or not. And this budget expenditure performance will determine the amount of budget to be allocated for tobacco control in the coming Ethiopian fiscal year. So we just mobilized our joint effort by involving civil society organizations, EFDA and Addis Ababa FDA, and developed an action plan to utilize the 4 months allocated budget. And as shown in the pictures here, quite a range of activities were executed to raise public awareness through printing and dissemination of various communication materials, displaying of tobacco control messages in outdoor advertisement by using huge screens located in major locations at the city of Addis Ababa. We also widely circulated newspaper articles involved in press release and panel discussions. There were a range of awareness creation activities through school mobilization by targeting different segments of the population and law enforcement officials. Then we reconnected or bring together higher officials of Addis Ababa FDA and also officials from Addis Ababa Finance Bureau and evaluated the budget utilization performance. And as per the report, we showed that there was over-utilization, and this created trust among the finance officials that the team at Addis Ababa FDA will be able to effectively utilize the amount of budget that will be allocated to them, even if it is at a higher rate. In addition, at federal level, there were quite a range of media engagements through live expert interviews and also publishing of newspaper articles, which are widely accessed by the decision makers to sensitize the importance of and the timeliness of allocating a dedicated government budget for tobacco control to enhance the government's good commitment in a better performance. After all these efforts, our country managed to establish its first ever dedicated government budget code for tobacco control, both at federal and city administration level for Addis Ababa. And as you can see here, previously, the tobacco control activity at federal level, it was shared with other project activities, but in the current state, it is dedicated only for tobacco control, and it is entitled as Strengthening the Tobacco Control System. It has its own budget, and this budget will be under regular government budget, and it will be a recurrent type of budget. And for the next Ethiopian fiscal year, a total of 145,469 USD has been allocated. At Addis Ababa level, a project-based capital budget was also created. Code was created, and it was entitled as Tobacco Control and Law Enforcement Program. And due to high budget utilization performance, the amount of budget allocated for the city administration was huge. It is around 750,000 USD, not only creating of the budget code and allocation of that amount of money, but also tobacco control was successfully included in the next 3 years strategic framework for budgeting, both at federal and city administration level. And tobacco control is also included as one of the key indicators in the national health sector 3 years strategic plan, which shows it is getting high level of priority in the health sector. And again, tobacco control is included as one of the key performance indicator measurements for EFDA and Addis Ababa FDA, which means it will be regularly reported to the Ministry of Health and also the parliamentarians. So the attention and the level of focus given tobacco control is significantly increasing. Of course, there were a range of challenges throughout our path. For example, the existence of competing national priorities and tasks was one of the major challenge for allocation of a bit lower amount of budget at federal level, lack of a dedicated team for tobacco control at Addis Ababa FDA level, and city-specific data was also another challenge. But there were a range of opportunities which helped us to achieve this budget advocacy objective. One and basic one was the advocacy window. The timeline was the perfect time because it was a time where the government was setting its next 3 years midterm expenditure framework for its finance. So unless this tobacco control was indicated in that framework, then it would have been very challenging to bring it to opening of a budget code and getting domestic funding for its enforcement. Higher government officials' commitment, as usual, was a great opportunity. The presence of evidence was key, and also the budget code decision was made by EFD and Ministry of Health officials. That was a great opportunity, which shortens our advocacy journey. As a next step, tobacco control team in Ethiopia will focus definitely on effective utilization of the allocated funding to get more funding in the next rounds of allocations. We will also focus on amendment of the excise tax proclamation because the rate is not being regularly amended as per inflation and GDP growth of the country. And also we will focus on earmarking of the excise tax to strengthen the healthcare system of the country and also bring about the budget advocacy agenda to other regions of the country so that the domino effect will be available. And we will also focus on budget tracking, ensuring accountability and sustainability. Finally, just to highlight the key takeaways from our path towards a dedicated budget allocation for tobacco control. Of course, repeatedly we have witnessed that political will can institutionalize domestic funding for public health. Evidence is key since this is an advocacy issue for the decision makers. They require evidence to make informed decision. A strong coordination and collaboration with civil society organizations and between government institutions is also key. One government institution should know the other better in a better way so that they will solve the gap that is created between them. And our advocacy messaging should focus that domestic funding for public health is not a cost, rather it is a physical protection strategy and it has a high return on investment. And when we start the budget advocacy campaign, we were not quite sure that this objective will be achievable, but now we have demonstrated that domestic resource mobilization is fully achievable. Saying all this, I will finally would like to express my deepest appreciation and gratitude for all government officials, civil society organizations, media, researchers, our donors and partners who actively involved in the entire process. And without our coordinated effort, this budget advocacy objective wouldn't have been realized. Thank you so much, and over Caleb.
Thank you. Thank you very much, Tizita. Your presentation is very spectacular because it shows us clearly that there is the possibility. It is possible to raise resources or to mobilize resources domestically for tobacco control. And I'm glad because the Ethiopia's case is specifically for tobacco control. And so this presentation was to let us know that it is possible to have allocated resources for tobacco control, for public health, for education, for other things. And these are developmental issues in our various countries where government usually says they do not have the resources, governments usually have difficulties meeting the needs of these sectors to the fullest. And here we are looking at a case where Ethiopia is showing us that with the right political will, they can actually organize themselves internally and raise resources domestically. And I'm particularly impressed by the fact that this was a multi-sector initiative because, yes, the government took the center stage with the political will and everything, but collaboration was there with the CSOs and development partners. And we also we all are now seeing the great results that you have in Ethiopia. Thank you very much, Tizita, and please stay with us because I know there are probably some questions that you would have to answer. Now, let's move from Ethiopia, which had the political will to do this, to another country, which is trying to get to where Ethiopia is right now. And how far have they gone? What are their struggles? And Ethiopia, their key point was political will. They had the will to do it. Wherever they got those resources from, we are not, this presentation does not tell us. But Ghana is specifically wanting to use revenue from taxes to inject them into health, into education, into other development aspects of life. Where are they right now? How far have they gone? Let's hear from Dr. Kombat, who is from the Ministry of Finance from Ghana. He's Assistant Commissioner of
Revenue Authority.
Thank you very much. Dr. Kombat Alex, you have the floor.
So if I can have my slides, please. They can share my slides.
Sure.
Okay. So good morning, good afternoon, good evening, depending on where you are watching us or you joined this webinar from. Thank you very much for the opportunity. My name is Alex Kombat, Ghana Revenue Authority. So I was given a topic, Ghana Policy Momentum, Driving Health Taxes for Resource Mobilization. Can we go on to the next? I have just 10 minutes, so I will be a bit fast. So the content is here, just a brief introduction, tobacco imports and taxes, legal and regulatory framework, successes, challenges, recommendations, and conclusions. So the next slide, please. Yeah, so Ghana actually levies health taxes on products that have negative public health impact. And mostly the products include alcohol, tobacco, carbonated drinks, energy drinks, sugar-sweetened beverages, flavored water, and even plastics. Now, these taxes are actually imposed at both domestic level and upon importation of these products. However, when it comes to tobacco, it is only collected at importation. And the reason is that since 2006, all tobacco products are imported into the country. And therefore, the taxes on this, of course, will be collected at the ports or entry points. And basically, we are talking about the customs division collecting this particular tax. Now, tobacco products in Ghana, everybody knows, attracts a mixed or hybrid tax regime. And this is actually in accordance with Article 8 of the ECOWAS protocol. So Ghana is among a few countries that have gone ahead to implement Article 8 of the ECOWAS protocol. And basically, it is about using a specific tax rate of USD 0.02 per stick, and then specific tax of USD 20 per net kilogram. And we are talking about ad valorem of not less than 50%. And Ghana has gone ahead to be able to implement this. So let's go to the next slide. Now, as I said, Ghana does not actually manufacture or produce tobacco products in the country. So almost every tobacco product we see in the country is actually imported. So what I did was to go into our system that actually administers the importation of products. And that is the integrated custom management system. So when I went into the system, I decided to extract tobacco imports from 2010 up to 2024. And then I did some analysis. And the table you see on the screen speaks of itself. So currently, Ghana imports tobacco mostly from Nigeria. So we are talking about, when you look at the cost, insurance, and fleet values in terms of tobacco imports, Ghana is importing over 727 million in terms of the value from Nigeria. And this is followed by even the next country is just about 41 million. And when you look at the net mass, that is also huge for Nigeria. So that is to tell you that most of our tobacco imports are actually coming from Nigeria. Now, when it comes to taxes on these products, as I said, we have the mixed tax regime. So we are talking about cigarettes, 50% ex-factory price, and the specific rate is Ghana pesos 28 per stick. In terms of cigar, is 50% of the ex-factory price. And then the specific rate is also 28 Ghana cedis per stick. Negro head is 280 Ghana cedis per kilogram. And then the snuff and other products, 280 per kilogram. Now, we also introduced taxes on electronic cigarettes and liquids. So it's 50% ex-factory price, and the specific rate is 50 Ghana pesos per milliliter. And then we also have electronic cigarettes, 50% of the ex-factory price, and then the smoking devices, 50% of the ex-factory price, and then the Ghana cedi is 50 pesos per milliliter in terms of the specific rate. Can we go to the next slide? Now, the legal and regulatory framework backing a collection of taxes on tobacco products. We have the Constitution of the Republic of Ghana. That is the 1992 Constitution. When you read Article 34, 1 and 2, it talks about the use of taxes and other instruments to actually check consumption of harmful products consumed in the country. We also have the Value Added Tax Act. We have the Customs Act. Now, this particular act has been reviewed. So the custom bill, that is 2026, it was passed by Parliament, awaiting President's assent. We also have the Excise Duty Act that has governed the administration of health taxes in Ghana. We also have the Excise Duty Bill that has already been passed, and it is also waiting assent of the President. We have the Revenue Administration Act also governing the administration of the health taxes. We can go on to the next. We also have the Excise Duty Amendment Act 2023, Excise Tax Stamp, that is 2023 as well. It governs the use of stamps to actually enforce a payment of health taxes, Excise Tax Stamp Regulation, which regulates the use of stamps. And then we have the Ghana Education Trust Fund, National Health Insurance Act. So all these laws are governing administration of health taxes, specifically those on the tobacco. Can we go on to the next? Now, implementation of health taxes or implementation of the taxes on tobacco, we have some success stories to tell as a country. Now, there's success stories are one, the excise tax revenue has actually gone up. So I have here the table 2022 to 2025, the revenue that accrued from imposition of taxes on the tobacco products. Now you can see that from 2020 up to 2022, we were using the ad valorem, and therefore the import excise duty specific is 0. In 2023, we introduced the hybrid system, and now you can see 2023, whilst the ad valorem gave us 119 million, the specific gave us 252.5 million. So that is to tell you that the mixed regime brought in a lot of revenue, and the total, you can see the total revenue went up from 185 million to 371 million. 2024, so we have the ad valorem even falling to 82 million, but the specific rate, using the specific rate, the revenue went up to 397.9 million. And just last year, we collected 606.3 million from the specific. So that is to tell you that implementation of the mixed regime has brought in a lot of revenue for healthcare programs. There's another success story, and the other success story is the prevalence rate. So when it comes to tobacco prevalence, Ghana is among the few countries in the sub-region that has very low prevalence. So you can see the graph. The graph indicates that prevalence rate in Ghana is just 4.8 as compared to other countries. So that is to tell you that Ghana is doing well when it comes to the use of the economic instruments to check consumption of tobacco. Now, success number 3, we are looking at the health expenditure per capita. Now, WHO requires that health expenditure per capita should be around 86. As at 2022, Ghana's health expenditure per capita was 83.4. That is below the WHO required health expenditure per capita. Can we go on to the next slide? Now, in terms of pricing or prices of the tobacco products, so price of pack of cigarettes increase. So when we implemented the hybrid system in 2023, a 20-pack of Rothmans increased from 21 Ghana cedis to about 27 Ghana cedis. So after the policy, so that is to tell you that the mixed tax regime actually had effect on pricing or prices of the tobacco products. Currently, Ghana was around 46% in terms of retail price share. In terms of the taxes share of the retail price, it's gone up to 47%. Although we have not gotten to the WHO required rate, which is 75%, I think we've gone up from 16% to 47% after implementation of the hybrid regime. There's also good news for Ghana. So the health tax index, this was conducted by UNDP. That was in 2024. And it was in terms of health taxes implemented in Ghana. And this, what they did was to score Ghana in terms of implementation of the health taxes. And look at the good news and the success story for Ghana. So reducing consumption of tobacco products, extent to which taxes are imposed to discourage the consumption of tobacco, UNDP scored as A. 2, extent to which customs administration and law enforcement agencies enforce the payment of import and excise tax on tobacco, UNDP scored as A. And this was 2024. I'm sure when they assess us again, I'm sure we are going to get A+ in terms of implementation of taxes on tobacco products. Can we go on to the next? What are the challenges when it comes to the use of taxes for tobacco control in Ghana? Our major problem is that we have introduced tax stamps to check illicit tobacco. Unfortunately, the tax stamps are not designed based on WHO Article 8 requirement, that is illicit tobacco protocol requirements, and that is a challenge for us. We also have a big challenge in Ghana where we have industry players involved even in smuggling of tobacco into the country and even policy interference. And this was seen when we were passing a law to actually introduce the mixed tax regime, where the industry players came in strongly to hinder the passage of the bill. So it took close to about 4 to 5 months before the bill was passed. Now we also have illicit importation of tobacco due to informal nature of Ghana borders. Now currently, Ghana has about 2,420 kilometers borderline. The fixed post cover only 32 kilometers. What it means is that we have a lot of the areas that we don't have custom officers actually manning the borders. And this has actually caused inflow of illicit products into the country. We also have some paucity of research. In fact, we've had a few of the CSO, especially VAST, has done well. They've carried out some research to actually back implementation of tobacco taxation in Ghana. And I think we have to applaud them for this. They've done very well. They've carried out a lot of research to actually back, but we still need more research. And unfortunately, the specific rates of tobacco products are not adjusted for inflation. This is also a problem for us. The next slide. Now, just recently, Ghana has come up with some health tax reforms, and I wish to mention them to you. So, as I told you, the Excise Tax Act, that is the A73, is being reviewed completely. Unfortunately, it has been reviewed, and Parliament of Ghana has passed the bill. Now we are awaiting the president's assent. So when our president assents to the bill, it becomes the law. What is contained in the excise duty bill? One, we are introducing hybrid tax system for wines and spirits. That is good news for Ghana. We want to review the existing sliding scale that actually imposes taxes on beer and then some other alcoholic beverages. 3, we want to have mandatory electronic registration of stock kits. 4, we want to improve the existing track and trace system. 5, we want to introduce more punitive penalties for non-compliance. And then we want to abolish the 20% excise duty on locally manufactured fruit juices. So these are the reforms that are contained in the excise duty bill. And as I said, it is currently sitting or on the decks of our president. And when he assents to it, it becomes law. And these reforms are going to be implemented to improve taxation of tobacco products. My last slide. So recommendations and conclusions. So 1, we wish we could be able to implement track and trace in line with the ITP. 2, if we can adjust specific rates for inflation, that will also be good for Ghana. If we need more research support tobacco taxation, we need to also know that the revenue that is being generated, if it can be ring-fenced to actually support NCDs, that will also be very good. So in conclusion, Ghana has made frantic efforts to reduce tobacco consumption. GRA has implemented tobacco hybrid tax regime in line with ECOWAS protocol. We are able to do this. Tobacco excise tax has had significant impact on revenue, and actually we are using that to support healthcare, and all stakeholders must support implementation of tobacco excise tax in Ghana. Thank you very much. The next slide. I'm grateful to you all for your attention. Thank you very much.
Thank you very much, Dr. Kombat, for that very insightful presentation. And you could see one thing that caught my attention, there were lots and lots of figures. Can you confirm that the figures you had in your the revenue generated from taxes over the past 5 years. Was that in cedis or
Yes, that is in Ghana cities.
in Ghana cedis?
That is in
Okay.
Ghana
I was
cities, yes.
I was getting scared if that was going to be
Yeah,
in
that is
USD.
Ghana cedis. We can easily convert it because the
Sure.
Ghana cedi to the USD is about 11, 11 Ghana cedis to just
To
one
1 US.
USD. So we can easily convert it. But the
Thank you.
specific rates have actually brought in a lot of revenue.
Of
Yeah.
course, of course, and I think that is the one of the things, the core issues we are discussing in this webinar today. It is to let us see just how much money it is possible to raise if we adequately tax tobacco products, and then that money can be re-injected into the economy, into NCD prevention and control, into other public health sectors, into education, into other vital areas of the economy. And we are so grateful. I know that the battle continues in Ghana. The fight continues to actually allocate some of these resources and effectively use them for public health in the country. And Dr. Alex, I think we want to thank you and ask that you stay with us because we might have some questions for you after the last 2 sessions. And the last session, we will be hearing from a country that is actually allocating resources from taxes for tobacco control. And that is Cape Verde. Let's hear from Mr. Gustavo Moreira. Please, you can take it from us. I know we have we have limited time, and I'm grateful that Jeff has done a great job responding to most of the questions we have on the Q&A on the chat. Please ask your questions if you have them, and we'll try to respond to them as much as we can. Mr. Gustavo, you have the floor.
Muito bom dia a todos. Aliás, boa tarde nesse momento em Cabo Verde. Eu queria, em primeiro lugar, agradecer à organização por esse convite e também felicitar a organização por essa oportunidade de partilhar um pouco a experiência cabo-verdiana da tributação no tabaco, mas também, de certa forma, promover esse debate a nível regional sobre a problemática do tabaco e da mobilização interna de recursos, que é um elemento muito importante e de grande relevância para o continente no seu todo e particularmente para os países que estão em vias de desenvolvimento. Agradecia, se possível, que eu passasse a minha apresentação, se faz favor. Só. Ok, muito obrigado, espero que estejam a ver todos. Bom, a minha...
Yes, we can.
Ok. Estou a tentar passar, não estou a ver se... Okay. Bem, deve estar aqui algum problema, queria ir seguindo. Ok, bom. Eu vou, relativamente à apresentação, vou fazer sobre 2 aspectos essenciais. Em primeiro lugar, a nível dos principais aspectos da reforma cabo-verdiana em termos da tributação do tabaco, mas também eu queria partilhar um pouco alguns impactos que essa reforma conseguiu nos dar desde essa fase inicial. Talvez para facilitar eu queria ocultar a apresentação e facilitar assim a apresentação. No próximo slide. Isto não está claro. Ok. O fundo não está claro. Bem, talvez deve ter havido algum problema técnico relativamente a esse quadro. Aquilo que nós queríamos apresentar com esse quadro é um pouco dar a ideia daquilo que nós temos estado a fazer em Cabo Verde, mas solicitaria que tentássemos repor o quadro porque não está claro, não sei o que se passa. O quadro está, esse quadro está claro. O anterior é que precisa de ser. O quadro anterior, por favor. Bem, talvez eu vou tentar explicar o quadro, mesmo assim. Não está claro, mas eu vou tentar explicar. Aquilo que eu tentei trazer aqui com este quadro é dar o panorama geral daquilo que temos estado a fazer na reforma em termos da tributação do tabaco. Em Cabo Verde, nós podemos resumir essa reforma em duas fases. Numa primeira fase, que vai até 2019, e uma segunda fase que vai de 2019 a essa data. Na fase que vai até 2019, nós introduzimos imposto especial sobre o consumo em 2004 e que tinha uma taxa ad valorem de 10%. Essa taxa ad valorem foi aumentada em 100% em 2012, passando de 10% para 20%. E de igual modo, em 2017 também alteramos essa taxa de 20% para 30%, ou seja, um aumento de 50% nos produtos de tabaco mais relevante. E em 2019, nós alteramos essa taxa de 30% para 50%. Estamos a falar da taxa de imposto sobre o consumo especial. Até 2019, aquilo que nós podemos verificar é que, na prática, tentamos melhorar um pouco a tributação do tabaco, inserindo fundamentalmente a taxa sobre impostos ad valorem. Na verdade, essa tentativa de aumentar a tributação por via de aumento da taxa ad valorem não surtiu o efeito pretendido. Ou seja, nem a nível de preços, de influência no preço final, nem a nível do aumento expressivo da receita e muito menos a nível da redução do consumo. Até 2019, praticamente, tentamos melhorar a tributação em série do tabaco, mas o instrumento utilizado não surtiu o efeito pretendido. Em 2019, nós acabamos por, após uma reflexão sobre o modelo existente, verificamos que esse modelo não dá satisfação àquilo que na verdade pretendíamos. Foi nessa base que começamos a trabalhar num novo modelo, reformamos a estrutura tributária sobre imposto de tabaco, recorremos à assistência técnica internacional. Devo dizer aqui que foi uma grande contribuição da Universidade de Cabo, da África do Sul, através do professor Cornet e da sua equipa, que eu queria aqui felicitar. Deu-nos uma assistência técnica muito valiosa nessa matéria, mas também tivemos apoios quer da OMF, dos parceiros tradicionais, quer da Organização Mundial de Saúde e também da própria FMI. Os trabalhos desenvolvidos nessa matéria permitiu-nos, de certa forma, alinhar a nossa estrutura tributária com as melhores práticas internacionais e que visava fundamentalmente ter um componente ad valorem, mas também adicionar um componente específico. Aliás, esse componente já vem da diretiva da CDAO de 2017. Portanto, se nós tivéssemos que classificar esse primeiro momento, diria que seria um momento de trabalhar exclusivamente com taxa de valor. O segundo momento foi uma reformulação da nossa estrutura tributária e alinhar com as melhores práticas internacionais. Podemos passar para o segundo slide, por favor? Slide seguinte. Ok, nesse slide seguinte nós podemos claramente verificar que a partir de 2019 nós introduzimos um componente da taxa específica sobre a de valor mínimo de 50% sobre os produtos de tabaco. Em 2021 aumentamos esse 20 para 40 escudos. Já em 2021 cumprimos o requisito mínimo da diretiva da CDAO, que exigia uma estrutura mista, ou seja, uma estrutura em que conciliava a taxa específica com a taxa de valor, sendo a de valor no valor mínimo de 50% e a específica correspondente a 2 cêntimos de dólares norte-americanos. Mas se repararem no quadro, a partir de 2021, continuamos a aumentar expressiva e significativamente a taxa em todos os anos, ao ponto que a taxa específica de 40 escudos em 2021 acabou por estar em 180 escudos em 2026, o que representa, em média, cerca de 2 dólares por maço de cigarro, que está um pouco, praticamente 3 ou 4 vezes superior àquilo, ao mínimo estabelecido pela diretiva da CDAO. Mas mais do que isso, dada a experiência verificada e o sucesso verificado no caso do tabaco, nós também estendemos essa preocupação para outros produtos nocivos, nomeadamente introduzimos também a taxa específica nas bebidas alcoólicas, nomeadamente cerveja, vinho, whisky e outras bebidas espirituosas. Como podem verificar, também aumentamos expressivamente de 2022 a 2025. De igual modo, tivemos também alguma experiência relativamente a viaturas novas e usadas até 4 anos, e em 2024-25 também alargamos essa experiência para refrigerantes como para produtos açucarados. Ou seja, a experiência, o sucesso verificado na tributação do tabaco levou-nos a estendê-la às outras áreas com tributação idêntica, e aquilo que nós pretendemos no futuro é exatamente alargar essa experiência para também produtos salgados e para produtos engordurados, para além da taxa de carbono que também já introduzimos. Devo dizer que essa experiência diz-nos claramente que a utilização sistemática da taxa efetiva, e nós nesse momento em Cabo Verde não temos uma legislação de atualização sistemática da taxa específica, mas os aumentos que temos estado a fazer têm estado a ser superior quer à taxa da própria inflação, como até do PIB per capita. Por isso, a nossa senda é ir melhorar a legislação nessa matéria, mas continuando com essa perspectiva de médio e longo prazo para que efetivamente possamos alcançar maior sucesso daquilo que já temos até o momento. Slide seguinte, por favor. Next slide. Ok, se nós verificarmos a nível do impacto, podemos claramente verificar que Cabo Verde, a parte vermelha representa o valor das vendas. As vendas em valor aumentaram expressivamente de 2017 a 2025, com uma ligeira queda em 2020 devido à Covid, mas que retomamos isso de uma forma expressiva. Ou seja, praticamente 2017 a 2025, as vendas em valor aumentaram em cerca de 87%. De igual forma, podemos claramente dizer que a quantidade vendida reduziu. Nós, em 2017, estaríamos por volta de 1 milhão e 27 milhões de cigarros vendidos, mas em 2025, tivemos, de 2017 a 2025, tivemos uma redução de cerca de 17% da quantidade vendida, ou seja, a quantidade consumida. Se nós repararmos, quer a nível do imposto, do total imposto especial sobre o consumo, que está verde, nós tivemos um aumento expressivo desde 2017 até 2025. Ou seja, a nível do imposto sobre o consumo especial, nós aumentamos em cerca de $1 milhão em 2017 para cerca de $10 milhões em 2025, ou seja, um aumento em cerca de 909%. Mas, de igual forma, podemos verificar que o peso do total dos impostos sobre o produto de cigarro aumentou também expressivamente, ou seja, estava por volta a cerca de 30% em 2017, passou para cerca de 75% em 2025. O que demonstra bem que a reforma empreendida acaba por ter os impactos positivos em toda a linha, quer a nível da quantidade vendida, que reduziu, quer a nível do aumento do volume das vendas, que aumentaram, quer a nível das receitas, que aumentaram significativamente, e quer a nível da proporção do imposto no total dos produtos do tabaco. Mas devo dizer que aqui a predominância desse imposto total dos impostos, é exatamente o imposto sobre o consumo especial, Excise Tax, que nesse momento está à volta acima dos 70% do total dos impostos. Ou seja, dá para dizer claramente que a vertente específica acaba por ser relevante e tem maior peso na estrutura dos impostos sobre o tabaco. Se poderia e dar o próximo slide, por favor. Esse lado, no fundo, acaba por trazer à tona aquilo que nós temos estado a dizer, ou seja, aquilo que nós fizemos relativamente à experiência do tabaco, que nos levou, de certa forma, a expandir essa experiência por outras áreas, por produtos similares, foi exatamente porque, na verdade, verificamos que, após a abordagem da nova estrutura tributária, os resultados foram claramente incentivadores. Cabo Verde recebeu o Prémio das Nações Unidas em 2021, que foi uma medida muito importante, porque não só incentivou o grupo de trabalho, mas facilitou, de certa forma, a tomada de decisões nessa matéria que é sensível. Como disse, o preço do cigarro mais vendido aumentou em cerca de 150% entre 2017 a 2026, mas, como tinha dito também, a quantidade vendida reduziu em cerca de 17% nesse período, enquanto as vendas aumentaram à volta de 87%. Devo dizer que há um elemento muito importante aqui a referir, que no que se refere à estrutura tributária, para além de um aumento expressivo a nível do imposto sobre o consumo especial, que tem uma percentagem acima de 900%, devo dizer que há uma característica até presente que nós privilegiamos a taxa específica, ou seja, no componente da estrutura de taxa, entre a taxa de valor e taxa específica, nós priorizamos a taxa específica, razão pela qual, nesse momento, a taxa específica representa cerca de 85% da taxa do imposto sobre o consumo especial, e em 2025, acaba por ser, nesse momento, a maior receita do tabaco, ou seja, suplantou a própria IVA, que tinha um peso mais relevante. Nesse momento, representa mais de 75% de toda a receita do tabaco, e praticamente está por volta de 56% a nível do montante das vendas, total das vendas, e representa cerca de 21% do total da receita de consumo especial do tabaco a nível nacional. O que significa que aquilo que nós podemos partilhar da experiência cabo-verdiana é que, através de uma determinação da mudança da estrutura tributária e através do forte engajamento, quer de parceiros internacionais, mas também da assistência técnica internacional, conseguimos implementar um modelo que dê vazão às nossas necessidades e cujos impactos são realmente motivadores e que nos leva necessariamente a utilizar essa experiência e estendê-la para as outras áreas, nomeadamente aquilo que eu disse a nível de bebidas alcoólicas, de produtos salgados, de produtos doces, de também produtos engordurados. E nesse momento estamos a fazer uma abordagem geral, ou seja, nós estamos a falar apenas da tributação do tabaco, mas estamos a falar da tributação ambiental e de saúde. E nessa tributação ambiental de saúde temos em cima da mesa quer produtos doces, quer produtos açucarados, quer a taxa do carbono, quer e taxa, aliás, taxa do carbono, como também a nível do resíduo sólido, ou seja, a abordagem aqui é muito maior, estamos precisamente a alargar essa experiência para as outras áreas de tributação, tendo uma perspectiva de abordagem global e transversal, que é a tributação ambiental de saúde, tentar salvar vidas, reduzir o consumo e aumentar as receitas para fazer face precisamente a esse convite, a esse desafio. Nesse momento temos cerca de 15% da receita proveniente do tabaco, que deve ser aplicada às medidas de controle contra o tabaco, mas temos estado também a financiar um conjunto de atividades esportivas e da política da juventude praticamente com as receitas provenientes do tabaco. Aquilo que se quer aqui, fundamentalmente, é procurar fontes alternativas, não só para fazer face a esses malefícios do tabaco e das outras bebidas e de outros produtos nocivos à saúde, mas ter elementos para garantir cada vez mais que tenha uma população mais saudável e que esteja em linha também com as práticas que salvaguardam a saúde e que preservam o bem-estar da população geral cabo-verdiana. É essa experiência que eu queria partilhar convosco. Estou disponível para as questões que se entenderam necessárias. Muito obrigado. E peço desculpa por esse problema técnico. Tá?
Thank you very much, Mr. Gustavo. We are running short of time, and so we will try to move very quickly. We have had several, we've had several layers of this webinar. We started with Jeff giving us an overview of the Cigarette Tax Scorecard, which basically shows us I would say how countries are doing in terms of taxation, tobacco taxation, with the objective usually really of getting taxes as adequately, getting tobacco products as adequately taxed as possible in relation to WHO FCTC recommendations, and ensuring that we not only raise revenue for government, reduce tobacco use, but also ensure that we can use some of these taxes to actually fund developmental issues. Then we had a plethora of presentations, first from Ethiopia, showing us just how effective such a policy can be. That is how it is indeed possible to allocate resources for tobacco control. And then we heard from Ghana, and then just now Cape Verde, who are really doing well in terms of getting adequate taxation for tobacco control. They are not yet at WHO standards. Very few African countries have gotten to that stage, but of course we continue to improve, and that is the idea. The idea is to use this webinar to encourage us to continue to improve, with the objective of us knowing, especially our government officials here, ensuring that we take the lessons of Ethiopia and see how we can effectively use some of this revenue to allocate something for our health and development priorities. So all of this, we are going to have a keynote address, and this, I'm sure, the keynote address will look into all of this in a very holistic manner and maybe touch more on how we can how such a system can effectively function, because I saw that as one of the questions that was asked. Ladies and gentlemen, permit me welcome to the stage Mr. Linstrom from the African Tax Administration Forum at TAF, and he will be talking about how we can bridge policy and implementation with evidence-based tobacco taxation for Africa. Linstrom, you have the floor.
All right, thank you very much. I was just trying to make sure that you can see my presentation. Please confirm that you can see my presentation.
The
Yes,
Are you able
instrument
to see?
needs to be in slide mode.
you can see it, but it's
Can you put it in full mode?
Okay, let me put it in full mode.
it's still coming with
It's still coming with
the
okay,
next
let me see.
it's we have two panes. The first pane is the side, and the second pane is the
Okay, let me try to share again, just a minute.
perfect. Oh, okay, not yet.
Better?
Same. If you don't mind, maybe we can have Margaret share on your behalf, so
Yeah,
that
the only challenge is I made an update because of I saw some of the questions
okay.
in the chat. So if it's all right with you, I'll just proceed with it. If you're able to
Okay,
see.
we can see, so please go ahead.
All right. Thank you very much. And I want to also thank the organizers of this particular event. Thank you so much for inviting ATAF. It's such a pleasure for us to be able to contribute to this wonderful discussion. Looking all the way from the opening remarks by the moderator, the ES who did the opening remarks, and the presentations that have been made, quite a lot of sort of key takeaways for all of us. I've seen from the comment section we have people from government, tax administration, ministries of health and finance, civil society, media, and there's a lot, I think, of key takeaways from the discussions that have happened today. So for purposes of just wrapping up the conversation, I would want to share just a few ideas around what we have seen work, both in the context of policy issues, which Jeff presented significantly on, and then some of the other colleagues touching on both tax policy, and also a bit of the administrative bit of it. How do you actually move from the policy design to the actual implementation of these reforms that we are talking about, and the potential impact that they have. And I know Ghana, Cape Verde, Ethiopia shared some very useful country experiences regarding what is already happening in this country. And I'm sure there is way so much that we can learn from what is happening in those countries and some of the other countries as well. So,
Linstrom, please,
yep.
before we move on, we've been advised that you can go to swap displays and it'll probably give us a full screen. Swap displays is just at the top of your screen.
Okay.
No, where you were presenting, there is a swap display just above the slides. You can go ahead and share again, and
Okay.
let's, yeah, go on at the top. At the top, you see, at the top, yes, there. Perfect.
Is that better?
Better. Great. Thank you very much.
Thank you. Thank you. Thank you very much. Most of us already know about ATAF, so I won't go back into it. But I wanted to share some interesting insights, and I think that the ES, when she opened, she gave a bit of the scope. And if you look at what is happening within our continent, is that we have a huge financing gap. We are talking about 6.4 trillion by 2030, and this is estimates provided by OECD. UNACTAD is giving us, again, a gap of around 2.2 to 2.5 trillion. And this affects significantly health and education. And these are key sectors for every single country in Africa and represented in this meeting, and many of the other countries that may not necessarily be in the forum today. So this is a big challenge. And we know that we are currently spending more on interest than on health and education, which is in itself is a very big problem. The other key issue that we continue to struggle with is low tax to GDP ratios in Africa. We are stuck around 15 to 16%. And what this tells us is that we are not able to mobilize revenue adequately compared to the growth of the GDPs in our country, which tells us there is opportunity for us to mobilize significantly more revenues based on the size of the economies that are there. Because on average, Most of the other advanced developed countries around 30, 32, 33, 34%. We average around 15, 16, tells us that we still have a lot of opportunities for us to be able to grow our revenues in that context. We know revenue is declining, and these are challenges that we have to deal with. Now, the beautiful thing about where we are today, it gives us the opportunity to have a candid conversation on the role of health taxes and tobacco taxes. And given that nearly every government that we have spoken to and every government that we have engaged has the same challenge of funding, of declining ODA, and every government is now looking for where can we get resources, where can we get revenues. So this is a very timely conversation, and for those of us working in the health tax space, whether in government or advocacy, or supporting government through technical assistance, in one way or another, this is a very timely conversation and a good time to engage governments on these specific issues. Now, if you look at excise taxation, one of the biggest questions that we get is, how important are these taxes? Now, if you go to officials from the ministries of health, the importance of tobacco taxes, alcohol taxes, sugar taxes, and all these other health taxes is a no-brainer for them. They understand, they know that this is a critical, taxation of this and some of the other control measures are important. The biggest difficulty we find is having the same conversation with officials from ministries of finance and policymakers who look at this issue largely from a fiscal perspective, not a health perspective. And the key question they always ask is, how much are we talking about? Are they significant enough to actually for us to pay attention to these taxes that we are talking about? So if you look at this graph is data from the African Tax Outlook. It's available. You can check it out. It gives you sort of a breakdown of the level of excise tax collection as a total compared to the total tax revenues collected in many countries. And of course, the levels differs from country to country. So if you look at countries like Seychelles, countries like Burundi, Zimbabwe, Tanzania, Kenya, Rwanda, they mobilize quite significant revenues from excise taxation. As you go down, then countries like Southern Sudan, Namibia, Benin, Senegal, they also mobilize significant, the share of excise taxes to total revenues is also significant, but of course differs from country to country. It's not as high as Burundi, for example, or Seychelles, which tells you then when we engage countries and we're having conversations, then we have to understand the country context so that then the message is nuanced depending on the specific country challenges and context. So for countries, for example, where they don't mobilize significant revenues from excise, you want to have this conversation more from a health perspective because we need to push for both health and fiscal policies. For countries where these taxes contribute significant revenues, it's much easier because governments see, especially ministries of finance, see this providing significant value from a fiscal perspective. And if you go to the next slide, you'll see that most of the excise revenues in these countries is coming from four key products. One is fuel, and I know there's a lot of debate as to whether fuel is a health tax or more an environmental tax. The next product is alcohol and then tobacco. So from a fiscal perspective, these are the key drivers of excise tax revenues in most of these countries, and this data is available. You can check it out. So these taxes are important, and as to whether governments should pay attention to them is a no-brainer. It is a yes. And of course, both for fiscal reasons and public health, which we discussed significantly earlier. So when we look at implementation of health taxes, we have really looked at it from a 360 angle perspective. What exactly is required to make sure that these taxes are effectively implemented? And I know the presentations that we've covered so far already highlights this. I would probably just add one or two things that I would like to also add on top of the conversations that we have already had. So we've looked at policy and policy issues, and I think Jeff really, spoke into this quite earlier. The excise tax structure, the excise tax rating, very, very critical. But also, we've looked deeply into some of the challenges, for example, like what Ghana was mentioning, porous borders, and a lot of these challenges. And we realized, even from a policy perspective, then regional harmonization is also a critical issue and a critical conversation that we need to have. And regions like ECOWAS, which Dr. Kombat mentioned, the directive, they already have a directive, EAC is already working on a directive. These are important policy conversations and policy decisions that then countries need to make, both at country level and at a regional level, for harmonization reason, and of course to prevent arbitrage of taxes and tax evasion. And of course, the linkage to other related taxes. We know that we use excise as the main health tax, but the same products attract several other taxes. And is an essential thing for us also, when we look at the design of the policy, to look at the excise being the key focus tax for health taxation, but the linkage to other taxes, including VAT, customs taxes, because they also contribute significantly to the total taxes. And I think Jeff clearly outlined that people who purchase tobacco products don't necessarily react to the tax, they are reacting to the price. And what determines the final price is several things, including the total taxes, excise and the other critical taxes that are there. So it's important that is also looked at. But beyond policy, then we also look at tax administration. And I put a statement here because I think it is a very important statement. Policy and administrations are not separate track. We are not looking at this from sort of one versus the other. It's not policy versus tax administration. They are on the same track, because good policy requires good tax administration, but if you have good tax administration with bad policy, it still doesn't work. So it's one track. Both needs to be done, and both needs to be done effectively. And when we look at tax administration, four key components we are looking at: the legal framework, the excise tax legal framework. Is it good? Beyond the policy design itself, how is the legal framework? Here you're talking about the licensing laws, the excise licensing laws, the controls that are provided within the legal framework, the compliance mechanism, the returns mechanism, all the tax compliance mechanisms that are provided, governance issues. Who is responsible for administration of these taxes? Is there a separate unit that is responsible for administration of taxes? How is governance structured? How is the capacity of the tax administration? Is it well capacitated? Do you have the right technologies? And I will talk a little bit about that as I finish. Then a lot of the questions also that came up spoke a lot about illicit trade, which is a big challenge and a big issue. Compliance, tax evasion and illicit trade. What measures are we put in place to fight illicit trade and tax evasion? And what tools, whether digital systems or other tools that are there, and I'll speak a little bit about that shortly. Then intra-country coordination and exchange of information. And this we have found to be a very critical component of implementation of tobacco taxes and the other health taxes as well. How coordinated is the tax agency with the other? In some countries, they have the Tobacco Control Board, depending on, again, countries. How is the coordination mechanisms within the government agencies that are responsible for implementing controls? And here we're talking about also coordination between the ministries of health and finance. And of course, regional coordination. The regional coordination, which means cross-border coordination within countries. I think when Ghana was presenting, for example, you saw a lot of the tobacco is coming from Nigeria and the neighboring countries. So the key question is, how is the coordination, how is the intelligence sharing, exchange of information between these countries? Because there could be many challenges around movement of these products between neighboring countries. Then I want to give an example with South Africa, because I think South Africa offers us a very good example of the impact of a well-designed tax policy, what happens, indexation, which we spoke about earlier, and tax administration. And South Africa is a good example because there is data available over a very long period of time, so it gives you sort of a trend analysis of a long period of time. So when you look at what happened in the 1990s, where there was a fairly good tax policy, but no indexation was there. Revenues fell by around 36%. Then around 1994 to 2015, indexation is introduced that is above inflation. And what we are seeing is revenues tripling and smoking prevalence falling. And what this tells you is that these things that we are talking about in the scorecard are not just theoretical, they are practical. You can see the impact of, for example, having specific rates, having indexation done both on the revenue and smoking prevalence. And the interesting thing is to see again what happens when there is weakened tax administration capacity. And we see this post 2015, where where the tax administration is not necessarily as strong as it was, and there's no track and trace, there's no way of monitoring a lot of the illicit trade in the country, and this continues to grow. So illicit trade rises in the country. And this shows you that there is clear evidence that if the policy is good or it's bad, there will definitely be impact. If tax administration is weak, even if the policy is good, then the benefits that you hope to realize you may not necessarily necessarily see them or realize them. Now, I added this slide because I saw some of the questions in the chat, and I think the questions are very relevant to our conversation today, especially the challenge of illicit trade. Because again, we know the illicit trade is used as an argument, especially by the tobacco industry and alcohol industry as well, to push back on tobacco tax reforms and even alcohol tax reforms, and say that if you increase taxes, illicit trade is going to go up. And therefore, as people who are government or support governments in doing these reforms, it's important for us to have a very clear understanding of what really causes illicit trade. Is it a tax policy issue? And this data here, and thanks to our friends from the World Bank and Euromonitor team that did the data, what it shows you is that on the right, right here is the transparency index. And what we see is countries with significantly higher transparency index tend to have lower levels of illicit trade. But if you go back on the other side, is that countries with lower transparency index tend to have higher levels of illicit trade. And the key message from this slide is that illicit trade is largely a governance issue, is largely an issue of whether countries have put in place the correct measures to fight illicit trade. And yes, a bad tax policy may contribute to some level of illicit trade in the market, but is not the key determinant factor. Largely, it's a governance issue, and it's important for us to have that clarity from the get-go. So I want to share just one or two examples of countries that we've seen do very, very well in some of the key areas. One is Kenya. So Kenya implemented what we call excisable goods management system a while ago, around 2013. And the implementation of EGMS, as popularly known, came, yes, with the implementation of the system, but it also came with other significant reforms in the law, the excise tax law. So they had a new tax law introduced almost at the same time. They had strengthened excise tax administration. They had a specific unit within the tax administration that was dealing directly with excise taxes, and a lot of whole of government approach to fighting illicit trade. And what we saw in Kenya is a reduction of illicit trade from around 15% in 2003 to around 5% in 2016, largely driven by tax administration reforms and technology reforms implemented in these countries. And so therefore shows you that a lot of this work in terms of addressing illicit trade, and we can share more details if need be, if we still have time. Now, another good case study is Tanzania. And what we saw in Tanzania, sort of very similar to what happened in Kenya, again, this from a revenue perspective, is reforms, both technology reforms, they're introducing electronic tax stamp system in Tanzania, but accompanied by significant reforms within the tax administration, which enabled implementation of this system. Of course, good regulations and policies in place at the time. And what we see is revenue jumping by 55%, and this is just excise. And like I mentioned before, because the other taxes that are also collected on the same products, there's also a jump on the VAT. And the interesting thing to note here is that prevalence, there is no evidence that prevalence grew by 55%. What was happening here is that the implementation of these reforms and the track and trace system in Tanzania enabled government to have visibility over products that were they did not have initially, probably being smuggled into the country or not being declared by manufacturers. So it provided visibility over products probably that were already being consumed in the country anyway. So again, tells you that a combination of these reforms work and is very, very critical. And the last example I want to give, again, from a tax administration perspective, is more recent examples from West Africa, and we've seen West Africa in Gambia and Southern Africa in Angola. And these countries also sort of following a very similar model, made reforms on the implementation of their digital tax stamp systems. And like I mentioned before, any country that are introduced digital tax stamp system is not about just the technology itself. It's about the comprehensive package of reforms within the governance framework of tax administration, having dedicated units to administer excise, having market surveillance units. So there's a whole package that comes with these reforms. And what we are seeing is taxes rising by almost 800%. And the numbers are there. And this is largely attributed to the implementation of these reforms. And we're seeing, again, same case in Angola, similar implementation of Procefa, again, coming as a package implementation with reforms within the tax administration, again, collecting almost 900% growth in tobacco tax revenues. Spirit sector also grew by around 20%. Again, showing you that this, if you accompany good tax policies that we've discussed with effective tax administration, then revenues go high. Like I mentioned before, the analysis doesn't cover prevalence yet, but I'm sure we'll be able to do that once the surveys are done. But there's no evidence that, for example, prevalence went up by 800% in Gambia or 900% in Angola. What happened is government had visibility over products that initially didn't have, which means they are collecting taxes on products that are already getting into the country anyway, which is good. So these reforms work, and it's important that countries that are thinking about policy reforms go ahead with the policy reforms, but also ensure that we are accompanying these reforms with administrative reforms that help government then implement these specific reforms. So as I wrap up, what recommendations then do we make for countries in these specific areas? And I think most of them already came out in the earlier presentations that have been shared by the other brilliant presenters. One is policy designs that prioritize health and fiscal objectives. And this should not be looked at as competing priorities, fiscal and health. Priorities, the health has to be prioritized in any policy design. And I think the scorecard clearly outlined this, and the FCTC recommendations is very, very clear on this. Then they should not be looked at as competing priorities, but one single priority for promoting health. Now, we know if you promote these reforms, tobacco consumption and even alcohol consumption is going to go down eventually. And I know this sometimes is used by tobacco industry to fight against these reforms, but this is good. If there's a decline over time, this is the goal of these reforms, and this is then should be encouraged. Of course, we don't see immediate fall of revenues, but we do expect that with reduced consumption over time, that eventually revenues will go down, which in itself is a core objective of health taxes. And I think this is something important that we always need to remember. So that then even when the industry fights back and says revenues will decrease, eventually, this is a good thing, it's not a bad thing. Then policy designs that simplify administration. Now, this again is very important for us because I know optimal tax policies sometimes can have challenges with implementation. And it's important then as we look at how we are designing them to make sure that, yes, they are effective in achieving the health objectives, but also make it simple to administer. And we've seen countries where they are providing significant tax incentives that are tiered against usage of raw materials. And I think I saw some of these in the questions. And we are saying this is not good practice because it makes it very, very difficult to control, manage, where you have tax rates, for example, differentiated based on the usage of raw materials, different tiers. All these things make it very, very difficult for tax administrations to monitor these taxes and therefore shouldn't be encouraged. We spoke about legislative reforms and then robust measures to fight illicit trade. And I can see a lot of questions around illicit trade. Now, one of the things that we encourage countries to do is get independent data on illicit trade. There's a lot of data available out there on illicit trade on different countries, but some of this data is not independent data. Some of them is data sponsored by the industry. And we know for obvious reasons that we cannot rely on this data. Unfortunately, most countries do not have independent data on levels of illicit trade. So even when we discuss policy reforms and the arguments around illicit trade come to the countries don't really have their own data to say to support their own reforms. And this is something, especially people who do research, civil society that encourage, support countries in research. These are good areas to look at. Supporting countries clearly identify the extent, the levels, the drivers of illicit trade in their countries, so that then this does not continue to be and also encourages countries to have a candid and honest conversation about policy reforms, but also how to counter this illicit trade. Track and trace systems, we spoke a lot about them. Their benefits are known, and strong enforcement and deterrent penalties. And I want to highlight this is a very key issue, having strong enforcement, because even in countries like Kenya, where there are very strong systems, you will notice that illicit trade has fluctuated depending on the level of enforcement at any given time. When there's a lot of government focus, a lot of effort being given to enforcement, illicit trade goes down. When there is not a lot of attention being given, again, illicit trade goes up. So even where there are good track and trace systems, good tools, good policies, then enforcement is still a critical component that needs to be implemented. Then another key recommendation is enhanced tax administration capacity. And we cannot overemphasize the need for capacity to implement the policy, especially within the tax administration. And here we're talking about in terms of numbers, in terms of technical understanding of the policies themselves, and in terms of the right technologies that needs to be implemented that way. Digitalization of excise tax administration. If you look at most of the African countries, we do have significant levels of digitalization in this sector. But we still have countries that are doing manual returns, don't have any way of monitoring production or import controls. These are still significant challenges that continue. Manual licensing processes that make it very, very difficult. Even getting data on collections for some of the countries is very, very difficult because they're still using manual systems. And these are priorities then that countries need to prioritize if health taxes and tobacco taxes are going to be implemented effectively. Lastly, strengthening coordination and exchange of information. Now, we do have a lot of frameworks for exchange of information, including ATAF exchange of information platforms. And these are available for countries to use. both in sharing information on health taxes, excise taxes, VAT, and several other taxes. And these are opportunities for countries to continue to use and strengthen the exchange of information. If you look at the tobacco industry in Africa, for example, there are a lot of multinationals. And some of these multinationals are based in probably a few countries, where the other countries are largely importers. And these products are moving across so many borders, and tells you there is a lot of information there that needs to be shared between countries. And I'll give you a very practical example. You'll find countries where one manufacturer produces, exports in 5 countries. All these exports are declared in the country where production is happening. They will declare this export is going to country A, country B, country C. But if you go to country A, country B, country C, you don't see the corresponding imports from those countries, even though they were declared in the production country as exports. And exchange of information between these countries would significantly resolve a bigger part of this issue, because then you're able to question this consignment, where did it go? Where is it? And these are opportunities for us to be able to look at. Again, intra-country coordination within the country. There are many bodies, and where we've seen effective implementation of tobacco taxes and other health taxes is largely countries that have very good coordination mechanisms within the country itself, and of course cross-country coordination. So these are all critical issues that we need to look at. And I want to conclude by saying that tax policy and tax administrations are not competing priorities. They both are critical, both are important, and both can be pursued at the same time. Because I know there have been places where there's an argument saying, let's fix illicit trade first, let's fix fat tax administration first, then we'll fix the policy later. And the message there's a message I would like you to carry today home, is that both are critical and both can be pursued at the same time. We do not need to wait to fix all illicit trade issues, fix all tax administration issues for us to increase tobacco taxes, or for us to review tax structures. These can be done simultaneously, and we think should be pursued simultaneously. So with those, I want to say thank you very much for your time, and thank you for allowing us to share this time with you. And from ATAF, really appreciate being invited and having the opportunity to share our ideas and thoughts around implementation of health taxes in Africa. So thank you very much, and back to you, Caleb.
Thank you very much, Linstrom. Powerful presentation, powerful keynote presentation, I should say. And we've gone way ahead of time. In fact, we've gone 40 minutes above our time. I wish we could go on and on and on. But please, we would beg to stop here, because I see that people still have questions, interesting questions. I take note of your question, Sarah Maurere from Uganda. And then I also took note of a question from Lutgard on asking if Ethiopia and Cabo Verde do not have tobacco industry interference. I will quickly say that for these countries, I think one thing is clear: they have the political will. And with such political will, of course, there will be tobacco industry interference, but the political will, the government surmounts that, because they want to implement these things. That's what I can quickly say about, because we don't have time, that quickly comes to mind right now. I'm not speaking on behalf of our colleagues from Cabo Verde and Ethiopia, but I'm just acknowledging your question and giving something from my head. That's for us to move ahead. And for your question, Sarah, asking what we can do in Ethiopia, given that the fund is there, and you have a 3-year project, and yet tobacco revenue from tobacco is being used to run tobacco control programs. So it seems to be a revolving cycle. But yes, as long as tobacco is a legal product in the country, it will continue to exist. It will continue to people will continue to use it. Unfortunately, it would be ideal if it's otherwise. But as long as this product continues to exist, then we'll continue to tax it, or we should continue to tax it, and tax it as much as we can, and then use the revenue to of course, allocate some of the revenue to public health and other developmental issues. We are going to end here. I would just want to give a minute to Jeff, maybe to give us one word. This was not planned, but Jeff, very quickly, if you want to say a word or two as we end today, having launched, I would say, a successful launch of the cigarette tax score for Africa. Over to you, Jeff.
Thanks so much, Caleb. And again, thanks so much our panelists here today and all of you for hanging in there. Obviously, people had so many important things to say that we went a little bit or a lot maybe over time. But again, these are really important topics and vital for our success in tobacco taxation. I will just end, Caleb, with just a reflection that this is an amazing opportunity for really every country in Africa. We can all raise these rates, and as a result, we can reap the huge rewards in terms of really decreased youth initiation is the big one here that we've heard about. But on top of all that, and we heard so much from Linstrom about how important this is an opportunity to generate revenues that we can reallocate towards good things. It's no panacea. We're not going to solve all of our fiscal problems with excise tax. I want to reinforce that, but it's a really important big chunk of money that we can use to make our societies better. And I really encourage governments to do this. And I encourage all of our non-governmental groups here to hold our governments accountable to making sure this happens. And again, huge thanks to everyone and a special thanks to you, Caleb, and Dr. Gonese at ATCA. It has been a pleasure to collaborate on this webinar.
Thank you very much, Jeff. And with that, we call it quits. A huge thank you to the interpreters for giving us quality services. A huge thank you as well to all of you participants for staying with us and going way 45 minutes above the expected schedule. But that shows that you are really interested in this topic. And I just want to say that watch out, our next webinar will be coming up, ATCA webinar on the 24th of September, and that will have to do with illicit trade and the illicit trade protocol. We'll be looking at why Africa must step up efforts to ratify the illicit trade protocol. That's also going to be an interesting webinar. You don't want to miss that. It will be coming up on the 24th of September 2026. Thank you very much, and it's been an honor to serve you today. My name is Caleb Ayong, and on behalf of ATCA and Economics for Health, EFH, we want to thank you all for being with us, and we hope to see you again some other time. Thank you very much. Bye.